Now, to the question of what probiotic, this is something we get a lot of questions about. And I've shared this concept on the podcast before, but I think it's truly worth constant reiteration. Occam's razor or Occam's posit, the simplest solution is usually the best, holds true here amongst many other areas in healthcare. And what we've been doing, myself and our research team, over the past few years is monitoring closely what's being published and trying to come up with an all-purpose protocol that summarizes across different trials, those for IBS, irritable bowel, for inflammatory bowel disease, for cognition, for depression, for skin and atopic conditions, for inflammatory and autoimmune conditions. If we look and take a big picture view, what can we conclude in terms of a meta all-purpose protocol, hence adhering to Occam's razor's posit that the simplest solution is usually best? And this is the meta protocol. There are 3 types of probiotics: blends of lactobacillus and bifidobacterium, and you can use these at a dose between 1 to 50 billion per day. Saccharomyces boulardii, which is a healthy fungus, at a dose of 10 to 15 billion per day. And a soil-based probiotic is the 3rd type, which can be used at a dose of 2 to 6 billion per day. And we have other materials if you want to take a deeper dive on that. The other point that I'll make is regarding the minimum duration. And we're trying to be very careful with the wording that we're using here. Minimum duration, meaning not maximum duration, but the minimum duration to assess efficacy, 2 to 3 months for any one of these 3 types of probiotics. Bear in mind that systematic review we discussed earlier, finding improvements in cognition in multiple domains of brain health, they were giving probiotics and recommended using probiotics for 3 to 6 months. So this is why we say the minimum duration to assess efficacy, totally being pragmatic and logical here. If a support, let's say probiotics, are helping, you'll likely have an indication a month in, but you may not see the pinnacle of improvement until 2 or 3 or maybe even longer. So look for an indication of improvement early on, about a month in, and then ride that wave, continue that protocol until you feel, and this is my thinking here, this necessarily hasn't been published, but it's a derivative of what's been published. Ride that wave until you plateau. You've been stable in that plateau for 1 to 2 months to make sure it wasn't a fluke, it wasn't a coincidence, and then try to wean off and find the minimal effective dose. So moving on to the next component here is sex hormones or steroid hormones. Why? Well, a 2018 review paper made the following remark. Several studies have found that hormone fluctuations are one of the key factors that lead to defects in cognitive function. We also know that brain fog-like symptoms may result from low testosterone in men or women, but it's probably more implicated in men, although you can make a case for both. And certainly estrogen and progesterone fluctuations can cause brain fog and mood lability in women. The first thing you should do to improve your hormonal health, my opinion here, is get healthier. Eat a healthy diet, improve your gut health, adhere to lifestyle practices that we know are going to improve your vitality. This should lead to healthier hormones. But there are some cases where direct support is needed. Without going into sort of an exhaustive list here are 2 things, one for men, one for women, that are simple and you should consider for optimizing hormones. Men, ashwagandha. 2022 randomized control trial, 50 men with low libido used ashwagandha at 600 milligrams per day for 2 months. They demonstrated increased testosterone and increased libido. Now, cognitive function wasn't assessed in this study, but this is just to make the point that if you feel hormones are implicated as a man in your brain fog, ashwagandha has been shown to increase testosterone levels and libido. For women, lots of options here. I tend to favor black cohosh because I've used for many years in our practice this supplement known as Estro Harmony. And a 2022 review paper did find that 40 to 160 milligrams of black cohosh per day for 3 to 6 months demonstrated a benefit or benefits for women's health, including hormones and hormone-mediated symptoms. Quoting this paper, therapeutic uses, this is for black cohosh, include pain associated with menstruation, relief of premenstrual symptoms, PMS, and relief of symptoms associated with menopause. Now, again, they didn't directly report on brain fog here, but knowing that one of the things that can happen with PMS and menopause is brain fog or low mood, I think this is a reasonable inference, and certainly I think it's safe to conclude that both of these supplements can improve male and female hormone levels and may very likely have a positive impact on cognition.